Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
uses of barbiturates. So uses of barbiturates one barbiturates are used in Crigler-Najjar syndrome. Crigler-Najjar syndrome is a childhood cause of jaundice. This Crigler-Najjar syndrome mainly occurs due to the deficiency of the enzyme glucuronil transferase. It is mainly a genetic defect. So in Crigler-Najjar syndrome, due to the inherited mutation, the child will have deficiency of glucuronil transferase enzyme. So this deficiency can be either partial deficiency or complete deficiency of glucuronil transferase enzyme. When this enzyme is absent, there is no glucuronidation will not occur. So bilirubin will undergo glucuronidation and it forms bilirubin glucuronide, and it is secreted in the bile in and then it is secreted into the bile and then into the intestine. With the help of bile, it is secreted. But whenever there is absence of this conjugation, so the bilirubin cannot undergo glucuronidation, and as a result the bilirubin levels increases in the baby. When this bilirubin levels increases to a higher level in the baby, the blood brain barrier of the baby is not mature, and as a result, due to the immaturity of the membranes, the bilirubin will easily cross the blood brain barrier in the baby, and it will result in kernicterus. So in such situation, in Crigler-Najjar syndrome, this phenobarbital can be given in Crigler-Najjar syndrome. So phenobarbital will hasten or fast that it will increase the clearance of congenital non-hemolytic jaundice. So for Crigler-Najjar syndrome, we can give phenobarbital can be given to the child.
thank you and thank you for watching.